Very good. Representative McClellan. We end with the state of Virginia as we begin.
Thank you, Senator Klobuchar, and thank you to all of the witnesses for being here today. I know I am all that stands between you and picking up your kids or getting on 95. I do want to thank Ms. Moss for the shout out earlier today, because you were who I was fighting for during those 26 hours in the Energy and Commerce Committee hearing. And I almost became one of the statistics of the Black woman 3 times more likely to die in childbirth than my white counterparts. And so I've spent a lot of time focusing on how to address the maternal mortality crisis, which, as we know, impacts women of color disproportionately, but all women, too many women of every race here in the United States are dying, and I fear that this big ugly bill will make that worse in 3 ways, some of which we touched on. So I have a couple of questions on that. We probably won't have time to get to all 3, but I first want to talk about the defunding of Planned Parenthood. And in Virginia, we are the only state in the South that does not have restrictions or bans, and we have become a safe haven for abortion access. But that means that as other states have not, the increase in the number of people coming has made providing care hard already. And so, Ms. Fry, can you talk about how defunding Planned Parenthood in a commonwealth like a state or commonwealth like Virginia, how that will make it worse for those states that are still providing service, but with many, many more patients?
Yeah, you're absolutely right. We know already from the data post the Dobbs decision that people are traveling farther. And so even, states like North Carolina, Virginia, even further north, are experiencing more patients, longer wait times. That creates more pressure and requires just more money to make sure that you actually can operate to serve all those patients. And so now if you're talking about getting rid of clinics who are absorbing a lot of that incoming, you're making matters much, much worse and making care not only unaffordable, but unavailable completely.
And what people don't want to talk about is the fact that there is a very direct correlation between access to abortion care and maternal death. And now the bill also includes a provision preventing the marketplace health insurance plans from including abortion coverage from receiving federal payments, even if the patient pays for the abortion coverage out of pocket. So can you talk about how that's going to impact women?
Well, it just makes care more expensive, right? Like, and it ironically interferes with states' autonomy to make decisions about whether or not they want to make sure that abortion is available in their states. They're eliminating the cost-sharing reductions or reducing those payments when a state has access to abortion. And so it effectively says if you have access to abortion, we won't allow for the cost-sharing payments to happen. And it just passes on those costs to patients themselves and patients who already are struggling to make ends meet. So it's a backdoor way of making sure that abortion is effectively not available or too expensive to access.
And more women will die as a result. So I was in the state legislature when we expanded Medicaid, and we saw how important that was, not only to addressing maternal health, but just helping connect people to medical homes and get preventative care. And Ms. Moss, you are somebody who is part of the expansion population. Can you talk about how this big ugly bill will impact you and your family directly?
I try not to worry, but I do worry, to be honest. And I have to try to keep myself calm and patient. It's scary thinking about as I get older. And my parents are getting older. So it's not like they're requiring less care, less time. As they get older, they require more care, more time. And I've been very patient with myself in terms of, building my business. But again, life is getting more expensive all the way around. So what I am always concerned about is just being able to keep up with everyday life.
Yeah,
And I don't think it should be that way.
yeah.
So it's very daunting to look out and look at the uncertainty of what should be civil rights, what should be human rights, what should be just an honest honoring of our humanity. We need health care. And it should not be something that is complicated. It shouldn't be something that we have to figure out, oh, should everyone be able to go to the doctor? At the end of the day, that's what this is about. Who can go to the doctor? Who can get the care they need? And I'm forgetting her name. I've been trying to think of it, but she's a friend of mine on Facebook. I know her from high school, and she has a child, and she's always posting, he's 19, and he's not been able to get Medicaid, and he's autistic. And the struggle that she has and just the phase that he's been in over the past few weeks has been that they have no assistance for the challenges that he's facing right now. And their entire family life is constantly at a state of crisis, just trying to keep him safe and trying to keep themselves safe without him having the proper services. So I think about myself. I think about all the people and all the stories I've heard since we've been in this fight, and there are so many instances of everyday people who are just trying to live and be healthy, and we have to fight just for a basic standard of life so that people who enjoy an extraordinary lifestyle already can have more, and it just does not make sense to me.
Thank you for that. We are fighting for you.